Hello, folks. Join our community and stay up to date all the time with the ESTES podcast series. This activity is sponsored by the ESTES Education Committee. Stay with us. Stay with ESTES.
Welcome, folks. Today we are discussing a fascinating study, Breaking the Silence. Communication failures are the leading errors identified in 10 years of trauma morbidity and mortality conferences.
I'm eager to hear about this. What were the key findings of this 10-year study on trauma morbidity and mortality conferences?
The core finding, and quite striking, is that communication errors were the most frequent type of error identified across 189 cases of severely injured trauma patients. This was a retrospective study at a Swiss-level eye trauma center, analyzing data from 2013 to 2022.
That's a significant finding. What other types of errors were identified, and how did they compare to communication errors in frequency?
Absolutely. Following communication errors, the next most frequent were skill knowledge deficits and procedural delays. Interestingly, communication errors often triggered subsequent errors, such as misdiagnoses or deviations from established treatment protocols. Think of it as a domino effect.
A domino effect of errors stemming from poor communication, that's a powerful image. Can you elaborate on the methodology used in this study? How did they identify and categorize these errors?
Certainly. The study used a novel error categorization system. They analyzed data from trauma M&M records and electronic medical charts, looking at demographics, injury characteristics, timelines, and documented errors. The error categorization included communication failures, skill knowledge deficits, delays, missed injuries, and deviations from algorithms. The errors were identified by consensus within the multidisciplinary trauma M&M team.
So it wasn't just one person making these judgments. It was a collaborative effort. That seems like a robust approach to error identification. What specific examples of communication failures were highlighted in the study?
Yes, a collaborative approach. The study gave several examples. One involved unclear reporting of imaging findings leading to an undiagnosed diaphragmatic rupture. Another was a failure to communicate the location of penetrating trauma to the appropriate surgeon. In essence, crucial information wasn't effectively conveyed or emphasized, leading to significant consequences. There were also instances where incomplete secondary surveys weren't mentioned during patient handovers, resulting in missed injuries.
I see. So it wasn't just about the initial communication breakdown, but also the subsequent lack of communication that compounded the problem. Did the study offer any solutions or recommendations based on these findings?
Yes, absolutely. The study strongly emphasizes the need for focused communication training for trauma teams. They also highlighted the importance of structured handoff protocols and timeouts to improve communication. The trauma M&M itself served as a platform for identifying these issues and implementing corrective actions, leading to revisions of clinical algorithms and triage protocols.
That's encouraging. It shows that these conferences aren't just about identifying problems, but also about actively working towards solutions. Were there any limitations to the study that you think are important to mention?
Yes, there were some limitations. It was a single-center study from a well-resourced Swiss-level eye trauma center, so the generalizability to other settings might be limited. Also, it was a retrospective study, so there's always a risk of recall bias. And the study population was a selection of patients discussed at the trauma M&M, not all trauma patients at the hospital. This selection bias could influence the results.
Those are valid points. Despite these limitations, the study's findings regarding the significant role of communication errors in trauma care are compelling and warrant further investigation. It highlights the need for improved communication strategies and training within trauma teams globally.
Precisely. The study underscores the critical role of effective communication in trauma care and the potential for significant improvements through targeted interventions and ongoing quality improvement initiatives like the Trauma M&M. Thank you for joining us today. We hope you found this discussion insightful. Goodbye.